Hello, everybody out there. Thank you for tuning in to The Local Lens, the podcast from the Powell County Health Department and Kentucky Rio, where we go inside our community's experience with the drug epidemic. And on this episode, we are joined by somebody who has a wealth of experience in substance use. This is someone who was going in one direction for decades and then experienced some tough life circumstances and was kind of forced to changing. And this is going to be her story, and we're going to learn her approach. Now, who are we talking with? Well, let's find out.
Okay, so I'm Linda Davis. I'm a retired judge from Michigan. I now run a group called Families Against Narcotics. We're a 501c3 nonprofit organization that deals with people that are suffering from substance use problems, addictions, and their families.
What is your purpose of being in Kentucky right now?
Well, I'm passionate about this subject. I had a daughter that went through a substance use problem. Fortunately, came out good on the other side. But I deal with families every day in my capacity as a judge and now as the leader of this organization that are not as fortunate, that have lost their children to overdoses. It's a topic that people don't talk openly and frankly about, and that has to stop because we're losing a generation of kids as a result of our silence. So I'm here to speak out about it, to talk about how broken the system is, what needs to be fixed, and hopefully motivate some very good people to take a different look at things and to move in a direction that will provide better services and pull your community together.
Well, let's go on and get into it then. I'm your host, Nate Brooks, and you're listening to The Local Lens. These are our people, using our voices, telling our stories, because no one sees it like we do.
Yeah, I was a school teacher for 13 years,
Yeah.
a prosecutor for 13 years, and a judge for 19 years. I've served on our governor's opiate task force. I actually ran it. I was invited to the White House to be on President Trump's task force for the opiate crisis. I serve on our present governor's task force in Michigan, and I travel all over the country. This is my fifth state in the last 5 weeks that I've been to as a speaker on this topic. It's something I'm passionate about. I've kind of self-taught myself and learned by trial and error, but I see a huge need for people to start talking about this issue, and I'm willing to go anywhere I'm invited to make sure that our communities are educated.
You better be careful with saying that you'll go anywhere you're invited.
Hawaii, here I come.
So from a professional standpoint, we should trust her. Now, how about from the personal side?
First, I guess I better go back and just say that, 17 years ago, I was raising a young child. She was a straight A student, an athlete. Everything was going great in our family. And she got addicted to Vicodin because of a knee surgery and eventually ended up on heroin. And it happened right under my nose, and I had no idea that it was going on. I was totally uneducated about addiction, even though I dealt with it every day as a judge, as a prosecutor, even as a teacher. And yet I was never afforded any education to make me understand addiction. So all I had to go by was what I saw on television, which paints a pretty negative, stigmatizing picture of addiction. It shows people at the end of their addiction, not at the beginning of it, of who they were before the addiction took hold. And I think that's really what we need to understand, is that people with substance use problems are not bad people, they're sick people. But we in society paint such a negative picture of the disease of addiction that our biggest task is to overcome that stigma and make people realize that this is a topic we need to be talking about. We need to be afraid not to talk about, need not be afraid to talk about it. And we need to realize that this doesn't mean that you are a failure as a family or that you are a failure as a person if substance use is in your family.
Because it can come into your life in a lot of ways, right?
At all walks of life. Yeah. I mean, certainly there are people that get involved in drugs just because they're experimenting, but that really is a minority of the people. Most people get addicted because they're suffering from depression or anxiety or childhood trauma. They're self-medicating to deal with the pain of all of that. or they get addicted because of a surgery, a tooth being pulled where they were prescribed a pain medication that was too strong for their body to handle. And addiction can happen very quickly with the strong medications that are on the market today. And it can just happen because kids will be kids. And I hate to say it as simply as that, but people have been getting high since caveman days, and kids experiment. They're going to go against the stream of what their parents have taught them. I don't care how good your kid is. They experiment when they get away to college or in their high school years. And the problem is that years ago, it was drinking, marijuana, hallucinogenics. You could party on the weekends and walk away from it. But with what kids are using nowadays, they're highly potent, they're very addictive, they change your brain chemistry, and they're incredibly hard to get off of, to just stop doing them without professional help.
How would you recommend that we get used to that, I guess, to having such dangerous things that kids are just playing with?
Well, I think we need to educate. Number one, I think we need to educate parents, because a lot of those things kids are playing with are coming right from the medicine cabinets of their parents. So parents need to be educated about this. I mean, just because you go to a drug program doesn't mean that you have a drug problem in your family. So we need to get over being ashamed to go into those programs to learn. We need to start talking. If you have a child that's suffering, don't wait until it's too late to help. Start talking about it now. I know I did that. I felt very stigmatized when I was looking for help for my daughter, and I isolated for a full year. I didn't even tell my family about it. It was the worst thing I ever did. I mean, it's very freeing to talk about this. Our group does that. We provide an environment where you feel very safe to talk about this. And I've been working with your community, telling them that they need to provide that same safe place for parents and people suffering from addiction to come to start getting answers they need and the support that they need. This is a daunting, difficult disease to deal with, but it can be dealt with. You can get into recovery, and recovery does work. I see it every day of my life. But I think because we stigmatize addiction so much, people that are suffering from it and their families feel like there's no way out. And there really is. You just have to find the right avenue for yourself. Don't be afraid to try different avenues. We are making some strides with like medically assisted treatment. And I know that some people think, well, you're treating an addiction with another drug. But this is a disease, and there's not another disease on earth that we don't have medications for. Yeah. So if we're going to call this a disease, we truly need to start treating it like a disease and be open to all kinds of avenues. I always like to compare like addiction to cancer. With cancer, sometimes you can just change your diet and it'll get rid of the cancer, and that's wonderful. Sometimes with addiction, you can change the nutrition you're eating, and that will really help start healing your body and move you in a positive direction. Some people can't do it through diet, so they'll take an oral medication for it, and that will work for them. It'll dissolve cancer cells, it'll kill them, and they can move on. With addiction, there are pills that you can take that will help with stopping the cravings to want to use substances, and it's tremendous because it clears your mind. It allows you to focus on other areas, counseling, group therapy, getting involved in community support groups without those constant cravings to want that. With some people with cancer, taking a pill doesn't work, and they need a stronger form of treatment. They may need radiation or chemotherapy. So they'll upgrade what they're doing. With some people, just taking a pill every day doesn't work. They might need an injection that will last long term, that will help with those cravings, and it doesn't require them making a decision every day to take a pill. But the bottom line is, if you are willing to figure out what kind of treatment works for you and stay the course to get it, and then we need to make sure that we're building a continuum of care. And that doesn't mean hospital care. It doesn't even mean doctor care. But we need to make sure that we stay the course with people. We know that it takes 2 years for your brain to heal from a substance use problem. So we need to make sure that we have services that will last for up to 2 years. And that can be as easy, and some people say, well, I don't want to have to deal with this for years. Well, hate to tell you, buddy, but addiction is a lifelong disease,
you're gonna
and you
be
need to
dealing
treat it lifelong. So just wrap your head around that you have to, that doesn't mean you have to every day go to the doctor, those kind of things, but get a good support system going. Go to some meetings. Be with people that are like-minded, that when you do have those moments where you feel like you're facing a trauma or that you're going to lose it and you might go back to using again, that you have people to call. Get a peer recovery coach, which is a person that is at your disposal that will help you work through any problem, whether it's employment problems, housing problems, transportation problems. They will be there to help you make that next right move.
Yeah.
And if you just keep taking the next positive steps toward your recovery, you'll be talking to me 5 years from now being substance free.
One of the things you said very well, first of all, we saw exactly what happens when those connections are cut off with COVID. We're actually doing good on our statistics with overdoses were lowering, deaths were lowering from like 2016 to 2019 pretty continuously. And then 2020, everything was just kind of like rocked again. So you see real effects when those connections are cut off. But there was a thing you said early on in all of that. That was when there's a pill that you can take or a treatment you can take that helps to clear your head long enough to get onto some other subject. A lot of people around here try to put that towards employment, trying to get people into some kind of job that they're really into. In schools, they try pushing after school activities that kids can get passionate about. Like that's one of the biggest reasons why you should have sports programs, because it just gives people something to do. What more can you say with the need to just have something to be like passionate about and be excited about?
Yeah, bored people, especially if they've suffered from substance use problems, are going to go back to using drugs. So you have to need to find something to fill that void in your life. I mean, taking drugs makes you feel good. That's what they're designed to do. That's why people take them, is they make you feel good. But it's the line. I mean, in the beginning you feel good, but then once that addiction kicks in, it's not a lifestyle that I've ever heard anybody say that they're enjoying. So a lot of people fill it with activities that they can do on their own. A lot of people get very passionate about yoga. Other people will get really passionate about going to the gym every day and doing something. A lot of people get really passionate about their diet and nutrition. But I really feel like the community, we used to do that back when I was a kid. I'm older. So back when I was a kid, we really did have a lot of community programs. We had a rec facility that did Friday night dances, and we had sports events, and they would get together, and it sounds corny now, but they were things that back then really worked. We would do like Halloween things together. I mean, carve pumpkins with neighborhood kids, and just things that made us give back to the community all the time. We were very community minded. I think we've gotten so we're such a fast-paced society now that we've forgotten that little things are really important. Policing is a big part of that. You know, our programming in Michigan really involves our police officers a lot. We want them to be part of the solution.
Yeah.
And I'm going to tell you, I know there's a lot of negative about police officers out there, but I've worked with police officers most of my career. I was a judge and a prosecutor, so you work with police officers in both of those capacities. And most police officers are really good people wanting to do good things in the community. They just don't know what to do with this disease. And they are seeing people at their very worst at the end, you know, when their disease is out of control. And so they can get very stigmatized about that. But if we develop good programming, I have yet to find a police department that was not willing to give it a try. All of that stems from my childhood. I was raised at a time where our neighborhood police were the kind that would drive down our street. We'd flag them down. They'd always have suckers in the car they would give us. And if we were shooting hoops or throwing the ball and playing catch, they would get out and play with us for a minute or two. And they were people that I felt like I could always go to. We've really gotten away from that. And I think community policing is really being begged for by our community. And I think it's what officers need to really buy into to change the stigma against them.
So I'm going to ask you about, because, well, a lot of things in this realm, because really this is an area that we should hit on for sure. Just the role of prosecution and corrections and all of that, and that whole side of things, because it's tough.
Yeah.
The buzzword and the whole topic of defunding the police. What is... Oh, you sighed. Your eyes have been rolled. What's your thought on this?
That's the most ridiculous theory I've ever heard of in my life. A society without rules and enforcement is chaos. And we already have enough chaos in our lives. That's the last thing that we need to do. But what we need to do is find a way to engage police officers in a positive light. I think they're ready for that. I think they realize that there is a problem, that they've gotten away from community policing, and they're open to it. So it creates great opportunities for organizations like you have here in your community to start partnering with the police to show society that they are willing to do the right thing. We just need to give them an avenue to do it. They play into that whole stigma thing too. For as long as I've been alive, we've incarcerated people with drug problems.
Yeah.
We now have, but that's because we truly thought years ago it was a moral failing. Well, get over it. We know it's not anymore. It's a disease. And so now we have to change those systems. And unfortunately, people with substance use problems are not criminals. They commit crimes because coming off those drugs is painful, and most people can't do it without help. And so they steal to support their addiction. Mm-hmm. And so if we start dealing with that in a really positive light and involving police officers in that process, and realizing that incarcerating people really is not resolving the problem, it's really just wasting taxpayer money, then we begin to develop programs that really work.
Which I would also like to, on the heels of that, take a second to forgive our past leaders in our country that have, maybe forgive is a funny word for it, but people have tried to make good decisions to help things get better. And it just turns out that as time has gone on that we were wrong about things. It's not awful to be wrong, but it is awful to know that you're wrong and keep going with it.
Yeah.
So.
Yeah, you don't know what you don't know until you don't know it. I made huge mistakes in my career in dealing with people with substance use problems because I didn't know. I only knew what I knew, and that was what I had been taught through TV programs and the messages that society was putting out there. But once you educate yourself, and I think our group has grown and has been successful because we don't dwell on what's happened in the past. We just want you to do the next right thing tomorrow. And I get doctors all the time that I'll work with that were huge prescribers, and they'll say, oh my God, I don't sleep at night. I feel so guilty about what I was doing. And it's what they were taught to do. I think there are bad doctors out there that know exactly what they're doing. But for most doctors, I think they were taught that opiate prescribing helped their patients, and they thought they were doing the right thing. And that's great for the past, but now there's a lot of education out there telling doctors that is not solid evidence-based practice, and that it's harming people. So I will blame you if you do it again tomorrow, because now you know. Yeah. So I do think there's forgiveness involved in this. I was angry at everybody. I was angry at God. I was angry at doctors. I was angry at myself. In all honesty, very, very little is ever accomplished with anger, and we need to learn to forgive people. We even need to learn to forgive each other. Like I was very angry at my daughter for a long time. She put me through hell, and so I was really even angry at her, and she for sure was angry at me because I didn't know how to deal with this, and I made lots of mistakes that she blamed me for. But that forgiveness is what allows you to move on to the next step, and as long as we're continuing to learn and to change, that's the best we can do as human beings. So we just need to be tolerant of people and give them a chance to do the right thing tomorrow.
So there is always room for forgiveness, but there is also always need for law enforcement.
Now, I'm not an idiot. I'm going to tell you that if somebody is stealing from me with a gun pointed at my head, I want them in jail. And I'm not saying that if somebody is getting violent with their use, that we should ignore that. There are some people that even though they have addictions, they belong in jail. There's some people that have cancer that belong in jail. There are some people that have this disease that belong in jail.
It's threats to public safety.
Yeah.
When that is a part of the equation.
Absolutely. But when it's just simple petty thefts that they're committing, as a judge, I can tell you that most people that came into my courtroom, when treatment options were offered and they were asked, is this something that you're willing to go along with? Understanding that these are simple offenses anyhow, and they're probably not going to jail, they're going to be on probation. Are you willing to let me put them into rehabilitation and stuff? And across the board, they would say yes. I think because of the prescription drug pandemic that we had and pharmaceuticals being out of control, people are really starting to be aware of the fact that this is affecting all families on some level. And they want to see the problem resolved, and the problem does not get resolved by putting people in jail.
Yeah. So, calling back to like your very first response to that when you don't have rules, it's total anarchy. A lot of people are going to say too that if you loosen laws on people using drugs, then that is going to result in total anarchy. Like some of these like safe using rooms that are happening in like New York City and Portland. What about those kind of things? How do you feel about those?
I think that's narrow-minded.
Okay.
To just be perfectly honest, we're not creating drug users by dealing with the problem at hand. These people are using drugs whether we are going to give them a safe place to use or not, or whether we're giving them safe supplies to use. They're already far into their addiction, and so, but what it does do is it makes our community safer. If you have people that are using in public parks and in restrooms in the McDonald's or the Burger King or Starbucks, I've walked into those places and seen dirty needles in the garbage cans. So I would much prefer that we give people a safe environment with clean equipment to use. It creates an incredible drain on our medical system to not do that. It also is treating people human. These are people that already have the disease. They're going to have it whether we give them safe supplies or a safe place to use. What we're doing is resolving a bigger societal problem, stopping Hep C, stopping communicable diseases like HIV. Dealing with those kind of things is being practical. It's not, and it's narrow-minded to not want to be able to do that.
So if you're coming from law enforcement side, which, to be clear, you've spent a lot of time in that side. If you're coming from that side, how hard do you think it would actually be for a police officer to stand back and watch, knowing what's going on here, knowing that like the years and years and decades of training on this is how you deal with drugs? How do you think that response would be versus should be, I guess, towards?
Well, I will tell you, harm reduction it was something that took me a while to wrap my head around. I mean, but it's all about education, and changes don't come easy. They don't come easy on little things. This is a big thing. So I'm not saying that your community should go out and do a safe use site right off the bat. But you need to move in that direction. We do it with all other kinds of diseases. We do harm reduction for every disease that's out there except addiction. And a lot of that is because of the stigma. And for police officers, it's a harder sell because they are dealing with the crimes that are committed because of it, and the crimes are still on the book. But I want to make it very clear, drug courts and treatment is not easy. It's not letting somebody off. I mean, I had people in my drug court that said, I'd rather just go to jail. It'd be a whole lot easier. Treatment is hard. Getting off of these drugs and living a drug-free or an alcohol-free life when your brain has been affected by those things is really a difficult task. There's nobody getting off with anything here. It's just a different avenue. We're using treatment rather than punishment. And punishing somebody for a disease is a ridiculous concept.
Can you give us a very quick rundown of what drug court is, like what that process is like.
Drug court does what treatment should be doing. They provide lots of wraparound individual services to individual. If somebody comes into drug court, they usually do an inpatient treatment program, an outpatient treatment program. If drug courts are really equipped well, they have a peer recovery coach that's working with those individuals, which is going to help kind of guide that person, do some life coaching with them, help plan their future, get them back into school if that's what they want to do, help them find a job if that's what they want to do. If they have medical needs, they help them deal with those medical needs. They kind of act as a life coach for that person for a period of time. The family should also be into services, and I don't know what your community has, but we have like coaching programs for families. We have a support group for families. We do a lot of things around family dynamics to help the family understand their loved one. And in my drug court, we would refer them to services like that. They were encouraged to go to our family programs that we had through FAN. If they need to be on medically assisted treatment, we would make sure that they were seeing doctors, that they were being monitored, make sure that they weren't being overprescribed. There was a lot of drug testing going on, which kept people off of the drugs because they were afraid of the consequences if they got back on it. And we stayed with those individuals for 18 to 24 months, which is long enough for their brains to start healing. Had tremendous successes with it because they were a continuation of care. We also provided like sober living for individuals that were in drug court to make sure that if they didn't have a safe environment, and I don't mean safe in that families are dangerous or are even necessarily using drugs, but if families don't know how to deal with addiction, if they haven't gotten help for themselves, I will tell you, I was not a safe family for my daughter to live in, and I'm a great mom, but I was in a safe environment for her to come back to because I didn't understand addiction, and I could easily undo what counselors would do by not knowing how to love her. Parents need to know how to love somebody with this disease.
Yeah, that is hard, I'm sure, because like
It is.
we were saying earlier, that's not something that people have in the past just openly discussed with each other. And that actually, okay, this feels like a good time for this. A lot of what you've talked about today has been arguing for compassion. You seem like an analytical person, though. Would you consider yourself an analytical person? Like, are you numbers or feelings?
I'm both.
Okay.
Yeah.
All right. Yeah.
I'm definitely guided by data. I want to know that what I'm doing is working, so I'm very data driven. But data without compassion is just data.
That's the best quote I've ever heard. I'm going to get that tattooed on my forearm. Thank you for that. Yeah.
You can steal anything.
Yeah. Yeah. If you could write it on a paper, I'll just get it like copied right over.
Okay.
For a policy standpoint, though, it seems like one of the best things you can do is just provide a lot of one-on-one personal attention. Would you agree with that? At least immediately, maybe? I don't know if that might not be a great question. But,
well, I can only tell you what I found works. I think my story is very heartfelt when I share it. It was 3 years of the most miserable time of my life in dealing with my daughter and her addiction, and fortunately, we were able to get through it, and she's living a very good, productive life now. But I learned a lot about that. I will tell you, I was tough before that. I don't think I had a whole lot of compassion. But when you go through an experience, you learn that I wanted her treated compassionately, and so I've learned to carry my experiences forward. And so when I broach legislation about passing bills, and I've had many of them that I've been involved with that I've gotten passed, I always lead with my personal story. Listening to a mother that almost lost her child talk about the pain of that and how it could be prevented gets their attention.
Yes.
But then if I want to continue to get funded or get them to do the next right thing, I better be able to prove that what I'm advocating for works. And so that's where the data comes in. So you lead with passion, You lead with your story, and then you prove that what you're going to do is going to work.
And if there's one thing that Judge Linda Davis seems to be all about, is things that work and programs that work. Now, finding those programs that work is a pretty tough task. So how are we supposed to do this? People have been trying to find what works for decades. And how do we do this? How do we move forward?
I really think that one of the parts, I think the whole system is broken when it comes to addiction, but the most broken is that people, they pit themselves against each other. People don't want to work together on this topic, and we're never, ever going to find solutions to this and really serve our communities. When you stop to think about we're fighting over the 10% that access treatment. We're not even looking at the 90% that don't. There's plenty to go around for everybody, trust me. Mm-hmm. But we need to get systems to work together. So we always are reaching out to people saying, hey, we want to start a fan chapter in your community. Invite all of your coalitions. Invite all of your healthcare people. Invite your police departments. We want to work with all of them. There's plenty for all of us to do, and there's plenty for all of us to fix. This operating in silos and thinking one program is better than another. I hate going into communities where I get done and people come up and go, that was a really good talk, but we're doing all those things here already. Well, you're obviously not doing them well, because I've looked at your overdose rates and it's off the chart.
Bad. It's bad.
Yeah. So until you show me that you don't have overdoses in your community, you're not doing so hot. Our best efforts, we save one life at a time, but trust me, we don't have all the answers. We're constantly analyzing, looking at what we're doing, what could we do better, changing programs. We started a program called Hope Not Handcuffs about 4 years ago. I bet we have made 200 changes to that program in that period of time. We're always looking at how can we do it better. We lost this person. Where did we fail them? What could we have done better to catch that person? And as a result of that, we continue to evolve that to be a state-of-the-art program. And if you're not doing that, you're failing your community.
Yeah. How big of an issue is pride when dealing with... It seems like you start getting a bunch of people that are been looking in the mirror every day and telling themselves, I'm a community leader, I've been doing things well, and you tell them we've got to do a lot better, we got to change some things.
Pride and ownership are a death to this community if you're doing that here. It really is. I mean, I'm constantly looking at other states and what they're doing, other programming, calling them, picking their brains. That's how we started our Hope Not Handcuffed program. We started our QRT with me going to Ohio and talking to them and how they did their program, going to West Virginia. We partnered with them. We brought them up here. We had them teach us. We don't have all the answers. When I have all the answers, I'm done, because then I'm done growing. Mm-hmm. So we're constantly looking out. I'm hoping that even while I'm here, I'll learn things from your groups that I can take. I think you guys saw me pick up Casey's Law. It's like, wow, that looks like something maybe I want to do in Michigan. So I'm constantly looking for things that we can do better, stealing ideas from other people, embracing them in it. We go into communities and they have some programming going, and we'll say, well, let us add family coaching to your program. Let us help you expand that. You're doing great at this. We need to start partnering. We need to start embracing each other, and we need to get rid of the people who are not doing their job and doing it well.
That sounds like a good message for election season.
And I'm not even running for office.
And you also definitely just gave me permission to get that quote tattooed on my body. So
this guy's going to have arm tattoos by the time we're done.
It's just a full script, just the transcript.
All right, so if this were a normal episode, then that is where the episode would end. But we had a room full of people during this interview, so some of the people in the room had a few questions for Judge Davis. So since they weren't sitting by microphones, you can't really hear them asking, so I'm just going to translate their questions and repeat them so that they are hearable to you, the audience. So bring it on. Let's get into that. So one of the questions we've got for Miss Davis is, how do you feel about jail reentry programs, ones like First Day Forward, which is a program that we've got an episode about with the link in the bio to this. So how does Judge Davis feel about these?
I think that we need to realize that the system isn't going to change overnight, and there are going to be people with substance use problems that are incarcerated. But what we need to realize is that if we don't provide treatment services to them while they're there, when they come out, statistics show that whether you're in jail 3 days, 30 days, 3 years, or 30 years, that relapse is likely to happen, and even death within 30 days of release if treatment is not provided while they're incarcerated. So programming around providing services while people are in jail are magnificent. They're even more magnificent when they're connected with programming when people are leaving jail. We need to provide the same continuum of care for those individuals where they're linked with peer recovery coaches, employment services, even simple things on how to manage a checkbook or a bank account. People that have been using substances have pretty much stopped all living in a practical sense. They haven't really handled money and those kind of things. So we need to really provide that whole system, that holistic approach to serving people spiritually, physically, and mentally if we expect them to be really successful in their recovery. So these programs like jail reentry programs where you're going in and you're working with people. What's really failed with them is we were doing Band-Aids in the beginning where we worked with them while they were in jail, but we didn't consider what was going to happen when they come out. As long as you're providing a continuum of care, the likelihood is that person will not become part of the criminal justice system again. It's a proven fact that if you deal with the root cause of addiction, that people are not necessarily criminals that are doing drugs. They are doing criminal acts because of the drugs. So if you deal with that problem and you resolve it, you don't ever see them back in the system again.
And here's another question that we had for her. So just as much as data can be used to reinforce good things, it can also be used to reinforce bad things. Like one instance that was mentioned was the data that would have been used to promote opioids as a treatment for pain in the first place. And this is really a question of trust. How do you trust data, and how do you trust the people that are interpreting the data and telling us how we should be interpreting data?
There's a difference between good solid data that's coming and voluminous. I mean, when you look at how the opiate epidemic started, it was based on one study of a very few people. It wasn't even good data. And if doctors had done a little research on their own, and so I think that's what you need to caution yourself for. That's why we work with universities, is that I can tell you anything about my data. I can tell you we do this, and this. But if you invite a third party in to really look at your data and really do a deep dive into it, then you start really realizing where you can make improvements. And that's why we do that, is that, we can always spin data to say what we want it to say. But if you're really doing the right thing with data, you want third parties to look at it so that they are keeping you honest with it and you're not just bolstering yourself. So, we use data to make decisions on how to better our programming, and everything. And unfortunately, doctors are busy. They were sold an unfortunate bunch of lies, and they bought into it. That's always when people say, are your programs best practice? And I'll say, well, they're working, That best practice thing is way overused in my estimation. They called opiate prescribing best practice for many years, and it's killed how many hundreds of thousands of people. I think what we need to look at is more promising practices and innovative ways to deal with this addiction. We don't have good, solid programming that's best practice because nothing has worked. So we don't have a lot of best practices around addiction. I think we can develop them. I think medically assisted treatment is leading us into a best practice. But I think it's also really dangerous when we ride on the coattails of best practice and we're not always going back and looking at that data. So best practice can be great with medically assisted treatment, but then if we get prescribers that are over-prescribing and people are getting really addicted to the medicines that are meant to help them, then that's no longer a best practice. So I think we just really need to scrutinize what we're being told. We need not just take words on face value and really do deep dives before we start hammering away at people's lives with prescribing things to them.
It's almost like you can't use best practice with opioid epidemic. It doesn't belong with best practice because there's so many different avenues. There's not one thing that works. And like you said, you have to figure out individually what works.
Well, I think we can develop best practices around it, just like we do with cancer. That's a very complex disease too. And yet we have developed practices that work with different stages of cancer. And what we try to do, though, is we try to lump people with substance use all into one little ball of wax. Not all of them need medically assisted treatment. Not all of them need injections that help them for a long-term thing. Some people can get sober with no medicine. So we really need to meet people where they're at and develop best practices around individuals instead of doing it as a group as a whole.
Just like with every county and every individual is unique.
Absolutely.
Every community that we go into, we have to get the feel for that community to know, what we need to do to help with the barriers there.
Right.
And that's what we see. Some people are doing great, others not so much, but that's where we kind of go in. It's not the best practice per se, it's just what's going to work for that county to help them.
Right.
And we had one more question about harm reduction vending machines, which are pretty incredible. They have actually, in the time since we recorded this interview, they have actually started operating some of these in Kentucky, and they have been found to work pretty well, really successfully. They're being used exactly how people intended them to be used, and fingers crossed that continues. But what are Judge Davis's thoughts on these vending machines?
Yeah, it's all going back to the stigma of addiction again. Perfect example, I'd be willing to bet that this library has a fire extinguisher in it, okay? Fire extinguishers are harm reduction, okay? Every building has one, yet this library is not likely never to catch on fire, okay? So we have we have extinguishers in every building. Most public places that are servicing people have EpiPens available because somebody could have a diabetic reaction while they're in there. They're harm reduction tools. It doesn't mean the library, if they have naloxone here or a vending machine for it, it doesn't mean they're ever going to have an overdose here. It means that they want to be ready in case they do. Harm reduction is preparing yourself for the worst scenario. In my estimation, we know that the system of care is broken for people with this disease. There aren't a lot of people. I just met with a large hospital conglomeration that they're overwrought with people with mental health and substance use problems, and they don't know what to do with them. So they said, we're gonna take a room upstairs that's empty, and we're gonna put mattresses on the floor, and we're just gonna send them all up there. That's not harm reduction. That's not good treatment. There are other solutions to it that we have to do. Those are people, they're a vulnerable population, and where we failed is people don't have easy access. It's not like if you're not feeling well with another disease, you can go to a doctor and say, I'm having stomach problems, and they check you and they say, well, yeah, we're going to get an x-ray of that and do some deep diving into what's wrong with you. You go into a doctor's office and say, I think I have an addiction, and they'll go, whoa, that's a big problem. You better get some help for that. There's no referrals. We don't service this community, and that's why they commit crimes. That's why we need to have naloxone everywhere that we can get it. We do a horrible job of serving this very vulnerable population. And so what we need to do is make sure that every business has naloxone. Jails, if they don't have diversion treatment programs, or even if they do, relapse is a possibility with people with drug addiction, just like cancer can come back again. Wouldn't we rather them have the tools to save their life and to give them a second opportunity rather than to let them die? So I don't think you can have enough vending machines to deal with this problem. We have a huge health crisis on our hands that we don't seem to be having any solutions to. So the least we can do is arm people with what they need to stay alive.
So along these lines, some things that are now available in Powell County, where this podcast was initially developed to be specifically for, we have these naloxone boxes, which these are different than vending machines. The vending machines are pretty fully bolstered to provide a spread of needs, but the naloxone boxes are at least a step. These can be found in several places around town. I believe we have 8 or 9 of them around the county. One of them I know for sure is at Easy Stop. So if you ever need naloxone, you can get it at Easy Stop.
I just think that we pass out Narcan like it's candy. Our organization does. Anybody that has any kind of touch with us, we do trainings before our family forums on Narcan. If you call us, we'll mail you a kit in Michigan. So, we do everything we can to arm this population because services, they're at a minimum. And we don't have, because of the brokenness of the system, we don't have enough services that if everybody decided tomorrow they wanted treatment, we don't have the beds for them. So we need to make some concessions here that harm reduction is the way we keep people alive until we do.
That is very well said. Maybe the cleanest way harm reduction could ever be described ever in the history of descriptions. So now we're going to give a second to tell you all about some available resources from Families Against Narcotics, Miss Davis's organization. Here we go.
We have some family programs that actually people from other states other than Michigan join. They're called Stronger Together. And if you go to familiesagainstnarcotics.org, it's just all one big long word, familiesagainstnarcotics.org, and click on programs. Go to Stronger Together, and you can join one of those online groups. And if you are a family member, you can start getting the support that you need.
We've got links for that all in the bio of the episode, so just scroll to wherever your information is, click on those links, get the information you would like that way. Now here are some closing remarks.
If you are a family member that's suffering with a child or a loved one that has substance use, or if you are someone who is suffering from it, don't give up on your loved one or on yourself. There are answers for this, and you can get your life back. You just have to be willing to work as hard as you are at your substance use problem, and you can have a really successful life again. So don't give up.
Thank you all for tuning in to this episode of The Local Lens. Please be sure to send this information to anyone who you think may need to hear this. We would like to really thank Judge Linda Davis for coming down to Kentucky for a little bit to share her knowledge and her experience with all of us, and for coming on the show and sharing her story and hopefully putting an imprint on the world and pushing this big old ship of ours into the right direction. This is The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do.